Well, I want to talk briefly about autoimmune diseases. This is kind of a fallback position for medical doctors. When they don't know the cause, they say, oh, you have an autoimmune disease, your body's attacking itself. Well, once you get the final word on it, get a hold of the book Epigenetics, the #1 bestseller, Amazon, in genetics and general medicine, and epigenetics, of course. Epigenetics, the death of the genetic theory of disease transmission, okay, and Dead Doctors Don't Lie, and Rare Earths Been Cures. These 3 books will cover autoimmune disease. It will blow your mind what we know. We know that medical doctors are wrong. None of these have your body attacking itself. It's absolute nonsense. Okay, let's look at lupus, irritable bowel syndrome, Crohn's disease, rheumatoid arthritis, kidney failure. These are some of the hundreds of diseases doctors put in as being autoimmune, your body's attacking itself. Let's look at something like lupus. Okay, lupus. The giveaway, of course, they've got the butterfly rash on the face, which is rosacea, which is caused by a gluten intolerance. So right away, you know there's a malabsorption problem. You can't absorb nutrients. And the lupus part, the joints and tendons and ligaments and cartilage and muscles and so forth, there's a problem there because you can't absorb minerals and other nutrients necessary for the minerals to work properly. So for lupus, you get on a gluten-free diet, no wheat, barley, rye, and oats, absolutely no fried foods, no processed meats with nitrates and nitrites in them, no oils, no gluten, and take your 90 essential nutrients. I like to use the healthy bone and joint pack, support and promote healthy maintenance, repair, cartilage, ligaments, tendons, connective tissue, disc between the vertebrae. Throw in the selenium, take 3 of those twice a day per 100 pounds of body weight, and watch what happens. Okay, your body wants to heal itself. It will support and promote maintenance, repair. And then rheumatoid arthritis, of course, is thought to be a autoimmune disease by the medical profession, which in fact is really 2 diseases. It's a bone-to-bone arthritis. There's a secondary infection with a bug called mycoplasma. It's a pulmonary bug, usually found in the respiratory system. And it has 2 different features. One, it has features of a virus, and it uses your DNA to duplicate and replicate, but also it has features of a bacteria, and you can kill it with an antibiotic, namely minocycline, a member of the tetracycline family. So, get the person on with rheumatoid arthritis, whether a kid with juvenile rheumatoid arthritis or an adult, you get them on the gluten-free diet, no wheat, barley, rye, and oats, no fried foods, no processed meats, no oils. Then you get them on 1 healthy bone and joint pack per 100 pounds of body weight to support and promote maintenance, repair of cartilage, ligaments, tendons, connective tissue, discs between the vertebrae, blah, blah, blah. And you can see where somebody could have lupus and rheumatoid arthritis, right? And then for the bug, minocycline, again, a member of the tetracycline family, for 2 weeks will kill the bug. And then all you have to do is deal with supporting and promoting maintenance, repair of cartilage, ligaments, tendons, connective tissue, discs between the vertebrae. And then there's irritable bowel syndrome, Crohn's disease, all these various diseases, colitis and so forth, diverticulitis, all these appendicitis. These are all caused by gluten intolerance. Okay, they're all caused by gluten intolerance. And you can't absorb things, so you could have 15 other diseases, including diabetes and high blood pressure and heart disease. But irritable bowel syndrome, inflammatory bowel disease, Crohn's disease, diverticulitis, colitis, ulcerative colitis, all these things are caused by really a secondary nutritional deficiencies to gluten intolerance. And kidney failure, okay, most of the time there's nothing wrong with your kidneys when you have kidney failure, but the blood supply that's supplying the dirty blood into the filtering units is plugged. So to get your glomerular filtration rate up and your creatinine levels down, you get away from the fried foods, the processed meats, the oils, the gluten, absolutely no wheat, barley, rye, and oats, and you take your 1 healthy brain and heart pack for 100 pounds of body weight to support and promote maintenance and repair. And then you throw in the Ultimate Daily Tablets, the Classic, the Ultimate Daily Tablets Classic, 3 of those twice a day per 100 pounds of body weight to support and promote healthy blood flow through obstructed arteries, support healthy blood pressure. And the Ultimate Cardio Sticks, 1 of those twice a day per 100 pounds of body weight. That's be 2 boxes a month per 100 pounds of body weight. And then the Ultimate Niacin Plus, 1 of those twice a day per 100 pounds of body weight. And all of this supports healthy blood flow through obstructed arteries, including in the kidneys. And when you have vascular dementia, coronary artery disease, all right, glaucoma, and then, of course, you throw in absolutely none of the bad stuff. It's absolutely imperative to stay away from the bad stuff. And your body wants to repair itself, and it will, given the right raw materials. This is not difficult. So, again, I urge you to get a hold of the book, Epigenetics, The Death of the Genetic Theory of Disease Transmission, #1 bestseller in Amazon in genetics, general medicine, and epigenetics. And then, of course, you want Dead Doctors Don't Lie, The Standby, the basics of all of this, and then Rare Earths Been Cures. These 3 books will set you straight on the autoimmune disease. If you've been diagnosed with these things, call us up. Call your longevity associate. Let us help you. And, of course, the odds are your doctor needs firing. And it's one of these things we're looking for help now. They're talking about because of singularity, because of the advent of more and more computers and robots to do the manual work of people or even the electronic work of people. Guess what? They're laying off 5,000 people. Oh, no, let me take that back. 5 million people. They're going to lay off 5 million people over the next year. 5 million people. All right, 5 million people are going to be laid off just because they're being replaced with computers and robots in the manufacturing industry this year. And then, of course, Macy's is closing down 400 stores. Walmart's closing down 400 stores. Remember when Montgomery Ward went away? All these stores are going online. The stores are going away. The jobs are going away. We're talking about 10 million jobs. All the things that are happening here in America are going away. Contact your longevity associate and see how you can get going with the longevity business. Get tax deductions that billionaires get for a one-time fee of $25. How's that? We'll be back with Dead Doctors Don't Lie for these messages.
When those aches and pains in your knees, elbows, hands, shoulders, and back crop up, reach for Longevity's CM Cream. Put CM Cream on a Q-tip and put it in your ear canal for relief from headaches and sinus pressure. A topical temporary relief from minor aches and pains of muscles and joints associated with arthritis, strains, sprains, and simple backaches. Why take aspirin or non-steroidal anti-inflammatory drugs that can cause stomach bleeding and liver damage? Just apply CM Cream liberally to the affected areas, and within 20 minutes or so, you'll have relief from those nagging minor aches and pains. You'll feel better for up to 4 to 5 hours. So the next time you have achy joints or muscles, do what I do. Reach for CM Cream for relief. And for systemic relief, reach for CM Plus capsules. If you'd like to learn more about nutritional supplementation, call your local longevity associate. And don't forget to ask about home-based business opportunities.
Numerous studies have shown the link between the intake of antioxidants and disease prevention. Foods and supplements are measured in an ORAC scale. ORAC is an acronym for Oxygen Radical Absorption Capacity. In other words, the ability to remove disease-causing free radicals from the human body. Longevity's Cell Shield RTQ has an ORAC value of 15,800 points per serving. Cell Shield RTQ contains resveratrol, known as an anti-aging compound, turmeric, known for promoting healthy digestion, brain function, immune system, and cellular longevity. Quercetin, a flavonoid, is known for promoting healthy blood sugar metabolism and healthy lung and cardiovascular function. Remove free radicals from your body with Cell Shield RTQ from Longevity. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
Okay, Doug, what pearls of wisdom do you have for us today?
I wanted to talk a little bit about weight loss, as I've got a story here from Reuters that his headline, number of obese and overweight children are under 5 alarming, according to the World Health Organization. They said at least 41 million children under the age of 5 are obese or overweight across the world, and say the number of obese and overweight children has risen by 10 million since 1990. There are now more overweight and obese children in low and middle-income countries than there are in high-income countries. In developing countries, the number of overweight children more than doubled to 15.5 million in 2014 from 7.5 million in 1990, driven by globalization and urbanization, according to the World Health Organization's Commission on Ending Childhood Obesity, better known as ECHO. Their co-chair, Saria Nishtar, said overweight and obesity impact a child's quality of life as they face a wide range of barriers, including physical, psychological, and health consequences. So almost half of the overweight and obese children under 5 live in Asia. 25% live in Africa, where the number of overweight children has almost doubled to 10.3 million in 2014 from 5.4 million in 1990. Libya, Egypt, Morocco, Algeria, Tunisia, and Botswana are the highest percentage of overweight children among the African countries. They say children who don't have access to enough nutritious food in early childhood are at a particular high risk for becoming obese, and when their food intake and activity levels change. Say children of migrant and indigenous people were also at a higher risk of becoming obese due to rapid cultural changes and limited access to health care. Now, I don't understand how limited access to health care is going to affect your amount of obesity and being overweight when we have a third of the people in this country, we're leading the world in being overweight, and we have the most access to health care of any country on the planet. So that doesn't make any sense.
Well, it doesn't make any sense if you're looking for truth, but if you're looking for increasing your income from people and you're a medical doctor, you say, well, anything that's going on with health, we see more doctors, the problem will go away, right? So that's just a sales campaign. They're taking advantage of a situation here. Now, the first time I went to China was back, it had to be 1980, 85, 86, and everybody there was skinny. I mean, everybody was skinny. There's almost no diabetes. Now you go to China, 50% of the people in China are overweight and obese, and diabetes is breaking them financially, okay, because they pay for everybody's health care. Well, basically the problem comes like this, and same thing with Africa. When I was in Africa back in the 60s, everybody there was skinny. Now there's so much obesity, it blows your mind. So what's going on here? Well, Doug, what happens is, as soon as a country gets into the leading edges of being a first world country, an industrialized nation, they give up wood stoves, no more wood ashes for the gardens, and they go to electricity. So they don't have access to their source of minerals, and so their appetites go up because they're minerally deficient, and they all gain weight. I mean, within 10 years, after moving to electricity from wood stoves, no more wood ashes in the garden, more electricity, guess what? They all become overweight because they're minerally deficient. And so what we got to do is get the word out, get on the 90 for Life program, the healthy blood sugar pack, 1 per 100 pounds of body weight. If you're on medication, take your fasting blood sugar every morning before you medicate yourself, and as your blood sugar drops, you take less medication. You're without medication for 2 weeks, and your blood sugar remains below 100 in American terms, below 5 in the Canadian terms. Guess what? You don't need the medication anymore, but you still need to stay on the 90 essential nutrients because there's not going to be these nutrients left in your food a week from now, a month from now, a year from now, 5 years from now. You still have to supplement. But it all is because of lack of nutrition. Get a hold of the book Epigenetics and Dead Doctors Don't Lie and Lose the Weight. We'll be back after these messages. Okay, Doug, let's go to callers.
Well, let's head to California. And Hattie, you're on with Dr. Wallach.
Hello, Hattie, you're on the air.
Good morning, Doctor. Well, good afternoon, Doctor.
How can I help
I'm
you?
calling about my Hello?
Yeah, go ahead. You're
I'm
calling about
my grandson.
Okay.
My grandson. He's been diagnosed with a hip impingement that causes excruciating pain. He plays baseball and has problems walking and running. And they're recommending an operation, a bone-shaving operation. And I'm wondering if you have anything that might help him to avoid the operation.
Well, tell me how much he weighs.
He's 19. He weighs about, what do you think, what? About 200.
Okay.
180, 200.
Okay. And does he have any other issues? Does he have any diabetes or anything like that? How tall is he? How tall is he?
He's about 6 feet, I think, about 6 feet tall.
Well, if he's 6 foot tall, 200 pounds doesn't necessarily have to be overweight if he's, fit. Sounds so he's playing ball. Okay, now hang on here. Okay. Shar?
Yes?
This is a Shar thing. Here's a 19-year-old young fellow. He's an athlete, weighs 200 pounds. He's got a hip problem. The doctors want to shave the bone off his hip.
No.
What'd you do for him?
I get him on a gluten-free diet, and I get him 2 healthy bone and joint packs.
Okay. Char's exactly right, Hattie. Yeah, he needs to clean up his diet, and everybody in the household, including mom and dad and grandma and renters and dog and cat and bird and fish, brothers and sisters, everybody's got to be gluten-free, no wheat, no barley, rye, no oats. He can have sweet potatoes with butter and cinnamon for breakfast along with some eggs or even a piece of meat or fish or whatever, kind of like they do in the continent. And but he does have to give up wheat, barley, rye, and oats, has to give up the processed meats with nitrates and nitrites, no fried foods, no oils. And then Shar said he needs 2 healthy bone and joint packs, and this is, again, to support and promote maintenance, repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae. Bone makes bone itself, and wouldn't hurt for him In addition to getting the 2 healthy bone and joint packs, that'll allow him to take 15 glucogel a day, 5 at breakfast, lunch, and dinner. He needs to use the Rebound, our sports drink that has 100 nutrients in it. Gatorade has 2, Powerade has 6, and our Rebound has 100. And so he should use that instead of the other sports drinks. And then I would also have him get what we call the Immortalium. And Immortalium is something that will help him encourage stem cells to regrow things, okay, to encourage stem cells to do what they do. All right? And then give us a call every couple of weeks. Let us know how he's doing. With those 2 healthy bone and joint packs, each one of them will have a wide mouth jar of the CM cream. He can apply the CM cream to his hip or any other joint that is in pain. He could also get, what would you add to the CM cream, Char, to get deeper pain relief?
Trauma oil.
Trauma oil, yep. 4 to 6 drops of the trauma oil in the CM cream. Apply that to the hip. Pain will go away very quickly. It'll give him pain relief for 3 to 5 hours. But after a couple of months, 60, 90 days, it'll be gone permanently. We'll be back with Dead Doctors Don't Lie after these messages.
Let's head to Los Angeles, California, and Mark, you're on with Dr. Wallach.
Well, Mark, you're on the air.
Dr. Wallach. Hi. Thank you for taking my call, Doctor.
You bet.
I'm calling about my cat, Buddy, today. He was about, 7 years ago diagnosed with feline immunodeficiency virus, and didn't, as far as I can tell, hasn't shown any signs of it until the last week or so. And he's not really eating. He's drinking water, though.
What does a cat weigh?
He's a heavy guy. He's got to be at least 15 pounds, I'd say.
Okay, 15 pounds?
Yeah, I'm estimating because I haven't weighed him recently, but...
Okay, so yeah, when was the last time you weighed him? What did he weigh?
You know what? I haven't brought him to the vet. It's been a couple of
Okay, so
years.
let's say 10 to 15 pounds. It's a big male cat. 10, 12 pounds is not unusual.
He's a husky guy.
Okay. So at any rate, in addition to not eating, what other symptoms might he have?
He's just, in the last day or two, he's like not using his litter box. He's going near it. He's not using it. Now, he seems pretty calm now.
Okay, well, let's ask Shar a question here. Shar?
Yes.
What question would you ask Mark about the cat food he's feeding to the cat?
If it's got green in it or not, for one thing. And how old is the cat? And maybe the cat had a stroke or something, too.
Okay. How old is the cat?
He's about, I'd say, 15 or close
15
to
years
it.
old, okay. And are you feeding him dry cat food or canned or what?
I'll tell you what, I'm feeding him dry because he had most of his teeth removed, not all, but most. And they said, the vets, and that's another reason I'm calling is, do you know anybody that practices using your...
Okay, stop. You have to answer my question.
Yeah.
Okay, I need to know about the dry cat food. Does it have grains in it?
Okay, no grains. I can give you the brand name if you want it.
No, I don't even know the brand names. Okay. You just have to read the label. Make sure there's no wheat, barley, rye, and oats in it, but make sure that cat is totally gluten-free. And then I would also... what supplement would you give that cat, Char?
I would give him Arthritis.
Okay. Arthritis, and where would you get the omega-3s?
Well, I would also give him, and with a cat, you could give him the EFA Plus.
There you go. And then I would also scramble some eggs. And like Char says, go ahead and puncture a couple of the EFA Pluses, which are made from fish oil. Squirt them all over the scrambled eggs that are scrambled in butter, not margarines. And then I would also make sure he gets a big boy like him. I'd give him a half a scoop of the Arthritis on his food. And let's go from there. Test him on the scrambled eggs. And don't forget the Arthritis. Don't forget the EFA Pluses. Make sure everything's gluten-free. Then call us in a week and let us know if he's picked up eating, particularly with the scrambled eggs and butter. And we'll see what we can do from there. Okay. Well, stick with us. We're going to be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Longevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities.
We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity 95 Crusade. We do have lines open. Give us a call toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. And again, if you want to live to be well beyond 100 chronologically, say 110, 120, 130, 140, 150, 160, 170, 180, 190, 200, well, being biologically 30, 40, 50, contact your Youngevity associate and ask for the books Epigenetics, The Death of the Genetic Theory of Disease Transmission, the book Immortality, and the book Rare Earths and Cures, and learn the secrets of the top 20 longevity cultures and why they have 40 times 100-year-olds we do. Why do they have 100-year-old per 250 of their population? We only have one per 10,000. What are their secrets? Contact your Youngevity associate and order the book Epigenetics, Immortality, and Rare Earths and Cures. Okay, Doug, let's go to callers.
Let's head to Kentucky. And Kathy, you're on with Dr. Wallach.
Well, Kathy, you're on the air.
Hello, Dr. Wallach.
Hi.
I'm calling for my friend Kelly, who has some fused vertebrae in her neck because they started crumbling a couple of years ago. She's fused from C4 to C7.
Now, did the doctors fuse her vertebrae, or did they fuse themselves?
The doctors did it. And she has some nerve damage in the fingers on both hands. She has, her gallbladder was taken out several years ago. She has been on the bone and joint pack for nearly 4 months and seeing a lot of progress. She's been able to drop her narcotics. She's had terrible neck pain, but she's dropped her narcotics from 600 milligrams to 100 milligrams a day.
Oh, that's good. That's very good.
Yeah, she's really, really pleased. She wants to get off all narcotics, and is there a way she can be free of pain?
Yes. Okay, how much does she weigh?
140. She's 5'4".
Okay. Any other issues? Any diabetes or high blood pressure?
Her blood pressure is a little high. They think it's because of the pain. Everything else is normal.
And why did they take her gallbladder out?
I don't know. She obviously had a lot of problems with it, and I don't know the rest of that.
Does she have any skin problems, you know?
No.
Okay. All right. Okay, Shar, this is a Shar thing. What would you do for this 140-pound lady who's obviously had some trouble with her vertebrae in her neck because the doctors fused them? Of course, she got compression fractures kind of stuff. They took her gallbladder out, which you know what that sort of suggests, and a little bit of high blood pressure. What would you do for her, Charmaine?
Basically, I would get her on a healthy bone and joint pack, and for the gallbladder, I'd get her on the enzymes, the ultimate enzyme.
Okay.
Get her on a gluten-free diet.
Very good. Okay, yes, exactly right, Kathy. She needs to be on a gluten-free diet, and the fact that she's showing benefit means she's absorbing some. But get her on a gluten-free diet. That'll speed things up. No wheat, barley, rye, and oats, no fried foods, no processed meats, no oils. And then for the gallbladder, Char is quite correct. I'd have her take 1 or 2 of those ultimate enzymes, say 2 to 5 minutes before each meal with a couple ounces of water. And then for the basic bone problems, Shar said correctly, I'd have her take, wouldn't hurt, let her go ahead and take 2 of the Healthy Bone and Joint packs, a full dose of everything at breakfast, full dose of everything at dinner time. So it'll require 2 Healthy Bone and Joint packs. She might even lose a little bit of weight, 5'4". I'd like to see her maybe weighing 130 maybe. And then, in addition to blood pressure, wouldn't hurt to throw in the Ultimate Daily Classic, which are the tablets, and have her take 3 of those twice a day. And let's see if that can help her support healthy blood pressure. Okay, Doug, let's go to callers.
Let's head to Illinois. And David, you're on with Dr. Wallach.
Well, David, you're on the air.
Yes, doctor. Thank you for taking my call as usual.
Yes, sir. What's
and
up?
I got 2 people, wonderful people, and I will be really brief here. One is 37 years old, 160 pounds, 5'2", and she's a lady, of course. And she was diagnosed with H. pylori and anemia, doctor.
H. pylori and anemia?
Yes, H. pylori bacteria, right.
Okay. All right. Well, H. pylori, of course, is a bacteria that infects people's digestive tracts, particularly the stomach, and you can get sort of a gastritis where there's blood seeping from the whole surface of the stomach. But usually when they have H. pylori infection, they got gastritis and ulcers. The doctors are going to put them on things like Prilosec, Nexium, these PPIs, proton pump inhibitors to stop stomach acid. Do you know she's on medication?
Yeah, she's on antibiotics right now.
Mm-hmm. Okay, antibiotics are good because it'll kill the H. pylori. Mm-hmm. And medicine for pain. And so what is she getting? Let's see here. Is she getting anything to reduce her stomach acid, any of those kind of drugs?
She didn't say, sir.
Any antacid drugs? I would just bet that she's on an antacid drug, may contribute to her anemia. And so what would you do here, Shar, for somebody who's got anemia, and there's many things that can cause anemia. Your bone marrow requires all 90 essential nutrients to make red blood cells. And so what would you do for this gal?
At 100, first of all, she needs to lose weight, but I'd get her on a gluten-free diet for sure. Mm-hmm. And I would get her on 2 healthy bone and joint packs, and then she needs, obviously she needs the enzymes before she eats.
Yeah, the ultimate enzymes, they go ahead and have her take 1, 2 to 5 minutes for each meal, a couple ounces of water. 160 pounds. She really needs to be on 2 of the Healthy Bone and Joint packs, if that's what you suggest for her. 2, 1 full dose of breakfast and dinner. And let's see here, 5'2", she should only weigh. Is that correct? 5'2"?
Yeah.
David?
Yes, I'm here. Yeah. 5'2".
She's 5'2", yeah. 5'2", I'd like to see her weigh 110, 115, so she needs to lose about 40, 45 pounds. What would you give her for weight loss, Shar?
I'd give her the ASAP.
ASAP, yeah. Have her get 1 bottle of the dropper bottle of the ASAP. Have her put a dropper full under her tongue 30 minutes for each meal. Let it absorb through her oral tissues. If she swallows it, it won't hurt her, but she won't get maximum benefit. And then she'll lose, after a week or so, she'll start losing a half a pound to 2 pounds a day. And this is also the enzymes and the gluten-free diet is going to help her absorb more nutrients, particularly minerals, and help her with the anemia. One more thing I would throw in for a lot of B12, that would be the de-stress capsules. Have her take 3 of those twice a day. That'd be 2 bottles a month for the de-stress capsules. Okay, did you have a second one quickly?
Yes, to kill the bacteria, doctor, for her.
Say again?
To kill the bacteria, anything that we should, other than what you just said?
She can certainly, well, she needs to stay on her antibiotics, but she could also throw in, what would you give her as a natural kind of antibiotic, Shar?
I'd give her the killer biotics.
Well, there you go, killer biotic. 3 of those twice a day is 2 bottles a month.
Thank you very much. And then the second one, doctor, is a gentleman, 34 years old, 5'7", 180 pounds. He's on dialysis. I gave him the Sweeties and the 90-pack and the Ultimate Daily. But he's concerned about the potassium and the phosphorus levels, as he was told that they were kind of high after he started taking the product.
Mm-hmm. Okay. Well, I'd, just keep going. And if they say it's too high, we can cut something down a little bit. But you can't get rid of the 90 essential nutrients. The important thing is is for him to stay away from the fried foods and the processed meats and the oils and the gluten, get rid of the things that cause the obstruction of the arteries, which cause him to be on dialysis. Okay? You said you got him on sweeties. Does he have diabetes?
Yes. Yes.
Okay, so 3 of those twice a day per 100 pounds of body weight. Take his fasting blood sugar before he medicates himself. And, I would just start there. And you want to be sure you get him the Ultimate Daily Classic, okay? That's the original formula, and that will support and promote healthy blood flow through obstructed arteries, which includes the kidneys, but also it'll support and promote healthy blood pressure. And give us a call every couple of weeks. Let us know what his measurements are, blood sugar, blood pressure, weight. Anytime he gets his blood test at the dialysis lab, we want to know his creatinine levels. And stick with us. We'll be back with more Truth, Justice, and the Longevity Way after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity, 90 for Life Crusade. And Douglas, go to callers.
All right, let's head to Michigan. And Brandon, you're on with Dr. Wallach.
Oh, Brandon,
Hi.
You're on the air.
Hi, Doc. How are you?
Okay, sir. How can we help you?
Well, I'm calling about my wife. I heard you mention earlier about lupus, and my wife has lupus, rheumatoid arthritis, Sjogren's. She gets migraines. She has leukopenia and anemia. She has very low energy, and her white blood cell count is always low. She's been prescribed the following drugs, and they are not helping her, which is very frustrating to me. Gabapentin, Cellcept, Plaquenil, prednisone, methotrexate, a daily antibiotic, Relpax, and Fiorset. And that's the basic thing. She's 5'5" and about 140 pounds.
And so basically, she's not getting any visible results or recognizable or recordable results from her medication.
Absolutely none. This has been going on for about 10 years, and it's just been slowly eroding.
Okay, Shar, why do you think she's not getting any benefit from the medication?
Because she's got a gluten intolerance and she's not absorbing her food, nutrition, or the drugs.
Very good. So exactly right here, Brandon. Your wife needs, and you and the dog and the cat and mother-in-law, kids, anybody living in the household, everybody's got to be gluten-free. Your wife's sisters and brothers got to be gluten-free. If her mother is still alive, she needs to be gluten-free, and all of her siblings gluten-free. And all of her sisters' children have to be gluten-free because it is passed on by women. It's a gluten problem. And she weighs 140 pounds. What would you give her, Shar?
Boy. Well, I guess she needs, I just give her the healthy bone and joint pack, I think, and then I'd give her, I think she needs the enzymes for digestion, obviously.
Would you give her for infection? Rheumatoid arthritis?
The rheumatoid arthritis. She could take the killer biotic for that, and also she could even take the oxybody for that, too.
Yeah. Okay, so let's go quickly here because we only have a moment or two. So Char's exactly right here, Brandon. She needs to get rid of all the bad stuff. No fried foods, no processed meats, no oils, no gluten. Everybody in the household is going to be the same way. I'd have her take 2 of the Healthy Bone and Joint packs per month, 15 glucogel a day, 5 at breakfast, lunch, and dinner, full dose of everything else twice a day. I'd have her get 2 bottles of selenium so she could take 3 of those twice a day. I'd also have her take the Killer Biotic, as Shar said. I'd go ahead and have her take 3 of those twice a day. That's 2 bottles a month. And let's see here. With the 2 of the Healthy Bone and Joint packs, she's going to get the CM cream, and she can put the trauma oil, say 6 drops of trauma oil for every teaspoon of CM cream she can apply to any of the joints in her hands or neck or knees, hips, feet, any place where she has active rheumatoid arthritis or any place where she has pain of any kind. And let's see here. The Sjogren's disease should be, that's actually caused by osteoporosis of the skull. And the leukopenia, that means white blood cell depression. Her white blood cells are down, and she's anemic, meaning her bone marrow cavity isn't getting all the nutrients it needs because she's not absorbing because of her gluten intolerance. And so those things will show improvement very quickly as soon as she and her environment is totally gluten-free and she's taken the 90. You're going to get nutrition into her bone marrow so the bone marrow cells can actually manufacture white blood cells and red blood cells. They require all 90 essential nutrients. And how many nutrients, Shar, are in all those medications Brandon's wife are taking?
Not one.
0, that's exactly right. And this is an absorption problem. She's got massive absorption problems. That's why she has lupus. That's why she has rheumatoid arthritis and Sjogren's and leukopenia, which is, again, reduction of white blood cells because her bone marrow can't make them, and anemia, reduction of red blood cells because her body can't make them. And if you want to speed things up even more, you can throw in the de-stress capsules for some extra B12, which also help with the red blood cells. And go ahead and have her take 3 of those twice a day. It'll be 2 bottles a month of the de-stress capsules. Okay. Give us a call every couple of weeks here, Brandon. Let us know all the measurements and numbers on your wife every time she gets blood work, but let us know how she's doing. She should show improvement very quickly. Well, thank you so much, Shar. Super job as usual. Thank you, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWorks disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order PureWorks.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Youngevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there, in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Youngevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the Ultimate Tangy Tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewable chewables, and besides that, they're not as good as Tangy Tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy Tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities. Imagine a rich, decadent chocolate that's actually good for you. Youngevity's Triple Treat chocolate is just that, an antioxidant-rich dark chocolate complete with probiotics to aid in proper digestion. This all-natural product contains no preservatives, and for those with dietary restrictions, it's gluten-free, dairy-free, glycemic-friendly, and kosher certified. Not only does Triple Treat dark chocolate taste fantastic, it contains super antioxidant blueberries to absorb free radicals with an ORAC value of 16,936 per piece. Triple Treat chocolate also contains a proprietary blend of probiotics with over 500 million live healthy bacteria per 8 grams at the time of manufacture, with 80% reaching the intestines, which is much more than most live culture yogurts. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
With increasing rates of osteoporosis, it's becoming more and more evident that most Americans have low blood levels of calcium. Some would say,
I get all the calcium I need from dairy products.
Unfortunately, that's just not true. Besides, most dairy products are homogenized and can contain steroids and antibiotics that kill off good bacteria in the digestive system. Not to mention, the human body needs magnesium to make use of dietary calcium. That's why Youngevity developed OsteoFX Plus, containing bioavailable plant-derived forms of vitamin D3, calcium, magnesium, zinc, copper, and glucosamine sulfate. OsteoFX Plus is formulated to support healthy bones and joints. Not to mention, OsteoFX Plus tastes great, unlike other products that taste like chalk or dirt. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. Fish has been thought of as a brain food for eons, but it's not the fish that's key. It's actually the essential fatty acids, EFAs, or omega-3s found in fish, called essential because they're necessary for good health and your body can't make them. So they must be consumed through diet or supplementation. Youngevity has developed the perfect supplement in SmartFX, an acronym for Sustained Memory and Retrieval Time, a concentration of DHA and EPA, both members of the omega-3 family, supporting neural path function and cardiovascular health for optimal mental concentration, awareness, focus, and agility. If you've got a mentally demanding career, you're a student crunching for the big test, or just want to maintain health for a sense of well-being, try SmartFX from Youngevity. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
Through his research as a veterinarian, Dr. Joel Wallach discovered that most health problems afflicting livestock can be prevented and even reversed. Many of these same health challenges also occur in humans. These too can be prevented and reversed. Doc's original formula, called the pig arthritis formula, alleviated all arthritis symptoms in animals. The same basic formula has been developed for humans, called the Pig Pack, which includes plant-derived minerals, a multiple vitamin complex, glucogel, and EFAs. Add to that Youngevity's OsteoFX Plus, a proprietary blend of liquid calcium, magnesium, and glucosamine. Now you have the Pig Pack Plus to make up the 90 essential nutrients Dr. Wallach has identified as necessary for sustained good health and longevity. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.